A stroke is a life-threatening condition that happens when part of your brain doesn't have enough blood flow. This commonly happens because of a blocked artery or bleeding in your brain. Without a steady supply of blood, the brain cells in that area start to die from a lack of oxygen. The following are the 5 important things to know about stroke. 1. Strokes affect the oxygen and nutrients supplied to your brain. The lack of delivery of oxygen and nutrients can be caused by a clot in a blood vessel obstructing the blood flow to the brain, known as an ischemic stroke, or when a blood vessel ruptures and prevents blood flow to the brain, known as a hemorrhagic stroke. 2. Strokes can happen to anyone. Strokes can happen to anyone regardless of age, gender, or race. Certain risk factors can put you at a higher risk of stroke. Risk factors are divided into 2 categories. Controllable, the ones you can control or improve. Uncontrollable, those that are not within your control. 3. Be prepared to spot the signs and symptoms of a stroke in someone having it. Using the following mnemonic, FAST. F equals face drooping. Ask the person to smile and see if the smile is uneven. A equals arm weakness. Ask the person to raise both arms and see if one arm drifts down. S equals speech difficulty. Ask the person to speak and see if the speech is slurred. T equals time to call 911. Stroke is an emergency. Call 911 at once. Note the time when any of the symptoms first appear. 4. Women have an increased risk of stroke. Stroke is the 3rd most common cause of death in women. According to the American Stroke Association, over 90,000 women die from a stroke in the U.S. each year. Every 1 in 5 women will have a stroke, and about 55,000 more women than men have a stroke each year, with Black women having the highest prevalence of stroke. 5. A stroke is a medical emergency. Every second counts when someone is experiencing a stroke. Once a stroke starts, the brain loses around 1.9 million neurons each minute. For every hour without treatment, the brain loses as many neurons as it typically does in nearly 3.6 years of regular aging. To learn more about the types, causes, and treatment of stroke, check out the link in the description.